the buzzword today, and it is driven by the Prime Minister, is Atmanirbhar. So it has become, it's driving the government policies today. It's driving everything that's happening in India. So although, whether it's Dr. Dua or Sudarshan or the Honorable Minister, they all talked about India being the pharmacy to the world. And, we cater to the world. I mean, we've been able to produce medicines which are efficacious and affordable. And, whether it's ARV or oncology or any therapy for that matter, even in US, 80% of the medicines which are sold are generics, and a lot of them come from countries like India and from India. So having said that, but although I'll be very short because I know we've short our times. So, but the major concern that we have, despite the fact that we take pride in saying that we are the pharmacy to the world, and we are, the dependence on some other countries for our active pharmaceutical ingredients, starting materials are a major concern for all of us. This is a issue which has been deliberated and decided, and debated for long time. I think it's all started in 2011, and now, so this COVID has hit us, very hard. And then the realization has set in that we cannot, for this critical sector, which is pharmaceuticals, you cannot depend on any other country for the raw material that allows you to make those pharmaceutical products. So I'm glad, and that the government has woken up to it. There's a huge initiative which has been taken up by the government of India, and keeping that in mind, and we are trying to help the Indian industry and India to set up API manufacturing facilities, because it's extremely critically important for us strategically also, because whether be it Europe or China, I mean, we cannot depend on any country for something so critical for making us the pharmacy to the world. So that is one. And secondly, when you talk about the healthcare, I think again the discussion has been on, and the minister touched upon it. That we need more doctors, paramedics, nurses to cater to our primary healthcare needs. Forget about COVID, where none of the countries, be it America or US, was prepared to face it. I mean, when you look at India, even post-COVID, pre-COVID, we needed more doctors, nurses, and the realization is set in even more now. So the whole medical education infrastructure needs to be augmented. And I think government is looking at it, looking at using the existing infrastructure, which is in terms of having the district hospital, which could be used for creating medical colleges, is being done by the government of India. They've already identified it. That initiative is already on. So what I would like to summarize and say is that, it's very, very important for us to, but the regulatory environment for that matter, when the Prime Minister said that our regulatory environment was creaky and cumbersome, and this is his words, I think this was a wake-up call for everyone. And today we know that the government of India and the Ministry of Health is working very hard and working, all the time to kind of streamline processes and streamline regulatory clearances and make them quick and in a more efficient manner. So I think when you ask me the question that, what do you think about the policies? I think going back, this Atmanirbhar word is going to drive us completely, be it about medical equipment, be it about pharmaceuticals, be it about the impediments that we have in making it, I think accessibility and affordability drives Indian pharmaceutical industry. And this is what the respect we earn from Africa, US, Europe comes from that. So having said that, I think the key word, as I said, is going to be self-sufficiency. And that is what the government policies are going to be driven.